Supervisor Roberts, thanks so much for speaking with us.
No, I'm glad to do it, believe me.
You entered office really at the height of the AIDS epidemic, and you also played a role in the city of San Diego getting its first AIDS hospice, the Truax House in Bankers Hill. What did you learn from that public health crisis, and how did you sort of carry it forward in overseeing public health at the county?
Well, first of all, when I was elected, it was a new subject, so to speak, but it was happening very, very fast. In fact, I had a couple of neighbors who both died in short order, just after, not too long after I was seated, and it drove home the fact it was a real crisis. This was affecting people, and at that time, you didn't know. I mean, are you in danger if you shake hands with people? What is this all about? I had to have people that really were knowledgeable. And that's one thing I've learned. Find people that really know what is going on. And I think because of that, because we've listened, we're making a lot of progress. I'm not saying that it's not a crisis today, because it still is. But I was really proud this year when we were able to announce that our Getting to Zero campaign is getting us there. We had last year over a 20% decrease in the number of AIDS cases. And this is at the end of 2017. I don't have the numbers yet for 2018. But we are down now. The number of new cases in San Diego is down at the level where we were in 1984.
You started your time in elected office during that public health crisis. In some ways, you ended it almost in another public health crisis with hepatitis A. That was a really difficult thing for the county and the city to get their hands on, or to really tackle. What did you learn from that whole crisis?
Well, one of the things was there's a background story there that someday will probably be told. But there are people that say, well, you didn't declare a health emergency soon enough. And nobody understands the real crisis was we didn't have access to vaccine. And we were worried that if the general public stampeded to get vaccine, we weren't going to be able to have vaccine for the people that were on the street. So while it appeared like people weren't doing anything, people were working feverishly. We were working with the hospitals. We were working with the federal government and we went on the private market. We spent a lot of money for about 30,000 doses of the vaccine so that we could respond. But we were really afraid if it became a community-wide panic, that we were going to be in real trouble, and that's why there was a little deferring in terms of declaring the public health crisis.
Right now, San Diego has a growing economy, low unemployment, and yet at the same time, we're seeing a lot more people on the streets, a lot more people struggling to afford a place to live. And a lot of people see this as evidence of a failure of public policy. How do you respond to that?
Well, there's probably some truth in that. Now, I'm not sure, there's a lot of different public policies. We're not building enough affordable housing. I grew up in public housing. Linda Vista, it was a large government housing project that was built in World War II. And we lived in what we call temporary units there. They're all torn down because they were fire traps. But the fact of the matter is, there was a time, I think, when we responded. In that case, I think over 3,000 units were built in very, very short order. We couldn't do that today if our lives depended on it. We have rules and regulations that are well intended, but they're used by people largely to say, no, we don't want housing. And if you say affordable housing, we don't want them. I mean, I'm going through this. I'm working on at least a half a dozen different projects right now, and I'm really hopeful that we can do that. The fact of the matter is, right across the board, we're not building adequate numbers of housing in San Diego.
Supervisor Ron Roberts, thanks so much for talking with us.
You're welcome, Andrew. Good to see you.